Hey everybody, Jennifer Levine from Jennmed.com. I'm here taking a little break on my hike to talk to you today about lower extremity edema. We see this fairly often in the primary care setting, mainly with older people. Lower extremity edema basically means fluid retention in your lower extremities or your legs. When there is fluid retention around the ankle area, it's called peripheral edema. And there are some reasons that you can get edema, and some are serious and some are not so serious. So I'm briefly going to tell you some of the most common reasons why one might have lower extremity edema. The most common cause of lower extremity edema is venous insufficiency. As we age, the veins in our legs do not work as well, and fluid tends to pool up in the ankles. This is not a very serious problem, but it can be annoying. Your legs may feel heavy. Some treatments for lower extremity edema caused by venous insufficiency is to keep your legs elevated when you're just hanging out at home. And also there are something called TED stockings, which are tight stockings that fit around the leg to minimize the fluid retention, and that can also help you with your lower extremity edema. One of the more serious reasons for lower extremity edema is something called a DVT, or deep vein thrombosis. This is usually unilateral in size, unilateral meaning one side only. Usually when you have lower extremity edema from the venous insufficiency, it's both legs. And usually a DVT is only swelling in one leg. Hopefully you only have a clot in one leg and not both legs. Symptoms of a DVT can be some discomfort or pain in the leg, mainly pain in the calf. You probably will have some swelling as well. But it's very, very important that if there's any suspicion for a DVT to have an ultrasound of your leg to examine the veins to see if there's any clots, because a DVT can turn into a pulmonary embolism. It can travel from the lower veins in the leg to the lungs, causing major issues including death. So have a very, very low suspicion. Some risk factors for someone developing a DVT is post-surgery, when you're not moving around as much. Pregnancy is a risk factor, as well as a cancer diagnosis can be a risk factor for a DVT. So those are just a few of the reasons for lower extremity edema. If you have any questions, please comment below. I'd be happy to help you in any way that I can. And thank you so much for tuning in. I'm just quickly going to give you a look of Lake Poway where I'm hiking today. It's so beautiful and I want to share it with all of you. Thanks guys. Tune in. Bye.